Progressives will get their debate on Medicare for All and questions abound. I skimmed this article real quick right before we started, and parts of it kind of got on my nerves. We're going to talk about it. The debate about Medicare for All is about to get more serious and more complicated. The idea of creating a single national health insurance program for all Americans has been a big topic of political conversation since 2016. For some of us, it's been a conversation for a lot longer. But okay, we'll say since 2016. When Bernie Sanders touted it during his Democratic presidential campaign, Medicare for All couldn't be anything more than a rallying cry as long as Republicans controlled the levers of power in Washington. Political circumstances are different now. Democrats hold the House majority, and as Speaker Nancy Pelosi's office confirmed to the Washington Post on Thursday, at least 2 committees will hold hearings on Medicare for All this year. So Jay Appel is on board with Medicare for All. One reason Medicare for All will get a hard look is that the Democratic Party's increasingly powerful progressives are determined to improve upon the coverage gains made under the Affordable Care Act, which has helped many millions get health care, but also left many millions still struggling. Or without health care, by the way. Struggling is a very delicate way to put it. A single government insurance plan, progressives say, would be more efficient and effective than Obama's awkward mix of private and public plans. Yeah, no kidding. You know who supports what progressives are saying, by the way? Every other industrialized country in the world. As proof Medicare for All can work, they can cite the performance of national healthcare systems in countries such as Canada, Sweden, and Taiwan, and England, and Ireland, and Denmark, and, God, the list goes on and on. I mean, and Italy, and France, and Iceland, and at least 36 other countries that rank ahead of us in healthcare. As proof Medicare for All is popular, all right, so 59% among adults. All right, so here's where, but a Medicare for All system, like any complex policy enterprise, would entail difficult trade-offs. Yes, it's really difficult. How are we going to afford cheaper healthcare? It's really difficult having cheaper healthcare where nobody's left out. I mean, man, I'm having a hard time reconciling that, aren't you guys? Aren't you a little worried? Aren't you like, it's going to be difficult having nobody left out? I mean, if nobody's left out, what the hell are we going to talk about? I mean, some people got to be left out, so we're like, hey, look at these left out people. I mean, what are we going to talk about on these talk shows if nobody's left out? What, we're going to be like, hey, we fixed this. I guess we're like all the other countries where nobody goes bankrupt for medical bills. Bah. Sounds difficult, so I get it. This is really difficult. This article points it out. At some point, advocates need to figure out how they'll handle those, how they'll overcome the inevitable political resistance. Okay, so difficult trade-offs. Doesn't say what the trade-offs are, but it'll be political resistance. Political resistance, i.e. the donors don't want this. So the people that serve the donors will try to resist this. There you go. The existing Medicare for All proposals would basically eliminate private... Okay, so wait, here's the question. Should private insurance have any role at all? No. No, they shouldn't have any role at all. I don't know why there's a whole section devoted to this, author of this article. The answer is no. They should have absolutely no role at all. They should go bye-bye. The existing Medicare for All proposals would basically eliminate private insurance. Good. Because the new public program would cover everything. Good. Every single American would belong to it, and the law would prohibit private insurers from offering anything similar. Good. The political benefit of this simplicity is that it's easy to explain. Yeah, it would also cover everybody, and it would save us money. It would also cover everybody and save us money. But wiping out private insurance would also mean ending the insurance arrangements that the majority of Americans now have, either through their employers or through Medicare Advantage. Okay, so you're bummed out that we're not going to get to pay 3 times anymore because we pay our copay, we then pay our deductible, and we pay for our insurance plan every month. They get us 3 times. I have health insurance. I got a sinus infection. To get a prescription for a Z-Pack cost me over $200. I have health insurance. My fiance's health insurance is over twice as expensive as mine. every month. Why? Because she's a female. Because she's a female. Nobody likes pointing that out, by the way. Nobody ever points that out. How actually how discriminatory gender-wise the Affordable Care Act is and our health insurance system is. Nobody ever talks about that. Which I've always found interesting. How Americans would feel about this is a big unknown. Yeah, they might like paying 3 times. They might like paying 3 times. As employer insurance gets more expensive, employers are passing along those higher costs to their workers in the form of higher copays and deductibles, to the point where some of the employees struggle to pay the bills. But we don't know how they'll feel about this. We don't know how they might be like, we like paying the bills. But employer coverage is still popular, at least according to some industry polling, underlined industry there. As the 2017 fight to repeal Obamacare and pretty much change of any sort is scary. Okay, that is a bullshit conclusion based on what that person just said. They said that support for employer coverage is still high. What are they basing that off of? Because people didn't want Obamacare repealed. Why did people not want Obamacare repealed? The Affordable Care Act, by the way, which is what it's called, because it's actually Mitt Romney's plan, by the way. Why did people not want that repealed? Because the alternative left out even more people. The alternative was even worse. So yes, do we want to have an additional 16 million people without health care? No, we don't. So we wanted to fight to not make things worse. That doesn't mean employer coverage is popular. That is such a bogus conclusion to jump to based on what was really going on, and it's not assessing the situation properly at all. But this article is trying to present some neutral, both sides bullshit. So they're using this incredibly lazy analysis to justify our broken beyond repair healthcare system. The first part of the article that was talking about why Medicare for All is a good thing made perfect sense. Then they get into, but should we have the health insurance guy? And now that they start making zero sense. This article makes no sense at all. The second half of it. Employer coverage is still really popular. Why? Because people didn't want to enact the AHCA, which would take 16 million people more off of healthcare. Makes zero sense. How generous should coverage be? Are you fucking kidding me? How generous? All right. No more copays, no more coinsurance, no more deductibles. Yes, that's right. Out-of-pocket would basically under Medicare for All. The only exception would be a provision that would allow some token cost sharing to encourage use of generic drugs. The logic here is that copays and deductible inevitably fall hardest on the sick because they have the highest medical bills. Oh, and guess what? We all get sick eventually. But zero cost sharing could also encourage people to get care they don't need. This is a bullshit right-wing talking point. Who goes, hey, I want to go to the doctor because it's fun? Does anyone do that? Does anyone go, I want to go? Sounds neat. Which, by the way, guess what? A yearly checkup, that's not something you don't need. That's something you fucking need. Oh, people might get care they don't need. They haven't been to the doctor in 10 years. They might go now. Good! You should get a checkup every year. Ask somebody who had a preventative checkup where a heart condition was found. Tell them you don't need to get a checkup every year. Tell somebody who had some type of heart murmur that could have been something more serious, and they found out a mild surgery was required, and if they didn't get that mild surgery, they'd be dead in 5 years. Tell them that a yearly checkup is you don't need that. People get care they don't need. Fuck off. Fuck off hard. I mean, do we need to continue? Do you guys see how the second half of this article that's trying to justify the for-profit insurance industry is bullshit? It's like they're not even trying. How should government finance the program? Medicare for All envisions the federal government spending a lot more money on healthcare than it does today. The government has to find that money. Guess what? We're already spending it. We're already spending it. We're already spending it. We're already spending it. Instead of spending it on a for-profit middleman, we would spend it in a single-payer system, and everybody would have Medicare. So we would just redistribute the resources we're already spending. This has been proved mathematically multiple times. A study funded by the Koch brothers with the intention to debunk Medicare for All failed at doing so and actually proved Bernie Sanders right that his plan would save money. We're already spending the fucking money. It's like saying, hey, everybody's paying $300 a month for a car, and the car's really shitty, and it's basically a lemon, but they have to pay this bullshit insurance company. We could get them a car insurance payment that's $200 a month, but technically the government would be footing that $200 a month because they would then pay it to the government. How can we afford that? You're paying less. We're already paying more. We're going to pay less now. Everyone pitches into it, and you pay for it. That's how it works. It saves money. We're already spending the money. We already spend more and get less than every other industrialized fucking country. Every other fucking one. All right, we're done with this. You guys get it. What a stupid article. I gotta present the insurance industry side. No, actually you don't. You don't. Not if it's gonna be complete and utter bullshit.
Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. Get your news on with Ron. Don't you wanna know what's going on? We're getting our news on today. You can tweet me an article at Ron Placone. We'll go through it together and make it our own. Get your news